for staying with us. This is a Tech Tuesday Metropole Business Center where we talk matters of technology. And now we move on to our first interview of the day. The African Continental Free Trade Area, AFCFTA, celebrates its first anniversary every new year. That is the 1st of January. Now, with the exception of Eritrea, all African countries are signatories to the agreement. Today, we focus on the relationship between trade and health based on how we can improve access to healthcare across Africa using technology. And looking back at the pandemic here, most businesses have incorporated technology in their day-to-day running of operations besides challenges, and the same has also been applied to telemedicine rather, where the inability to move vaccines around the world during the pandemic, among other reasons, is estimated to have cost global economies about $9 trillion. On an article by Ngozi Okojo-Iweala, a recent academic study commissioned by the International Chamber of Commerce, which posits that if wealthy countries are fully vaccinated by the middle of this year, whereas poor countries with limited access to vaccines are frozen out, the cost to the global economy would exceed $9 trillion, greater than the combined GDP of Germany and Japan. And wealthy countries would bear half of these losses. Now, the losses will be significantly lower if developing countries are able to vaccinate at least half of their populations by the end of the year. Today, discussing how best we can improve access to healthcare across Africa using technology, we are joined by Michael Moland, co-founder and CEO, Field Intelligence, which is a health tech startup in the development of the pharmaceutical supply chain provider in emerging markets. Michael, we're glad to have you.
Thank you for having me, Tabitha.
Okay, great. Now, Michael, the relationship between trade and health is very critical. But first things first, let us understand who Field Intelligence is.
Sure. At Field, we are building the future of the health supply chain in Africa. We are a licensed, regulated pharmaceutical distributor, but we've wrapped that in the kind of technology and financial services that have really reimagined what distribution and what the pharma supply chain can do. We allow every chemist, every clinic and hospital, every telehealth or virtual health provider, even every manufacturer and insurance company to plug into this supply chain in a way that really reduces their cost, completely changes what they have access to, and allows them to focus on treating their patients and doing their work.
Okay, great. Now, so many people might not understand the role of the African Continental, free trade area in regards to trade and health. But maybe you can take us through that, because the inability to move vaccines around the world during the pandemic, among other reasons, is estimated to have cost global economies about $9 trillion, as we have stated, we clearly stated. Now, as a health tech startup, what have you done and will do to improve access to healthcare across Africa, as a health tech startup, and also in relation to trade and health when it comes to the Africa Continental Trade Area?
Well, that's right, Tabitha. And I think there are so many things that we need to do as a health community, as an industry, to bring more manufacturing to the continent, to do more to influence the decisions and the investments of manufacturers worldwide. But at least from where we are at Field, we've been very focused on what can we do with the drugs that are on the continent? What can we do with what is being manufactured here? Because there are tremendous opportunities to improve. So, for instance, all the pharmacies in our services, we take on all the exploration risk, and we technology and our own processes to unburden them from losses to drugs that might sit on their shelf. The typical pharmacy can lose 10 to 12% of their drugs a year to expiration. This is a large amount wasted. Once they've joined, we can reduce that number below even half of 1%. So there's a huge amount of savings that we can apply just simply by using technology and process and reimagining how we all work together. Also for our government clients, the public sector clients who use our software have saved millions of dollars in averting potential expirations. So I think a big part of it is simply doing more with what we have, but also removing the barriers that pharmacies and hospitals have to expanding the range of drugs they offer. So with our financial and our supply chain services, there are no barriers to expanding the kinds of options that patients need, which of course drives more demand. It kicks off this virtuous cycle with manufacturers to increase options for patients based on what is already on the continent, and it also drives demand, which helps build up that investment case for investing more into African health systems.
Great, and you have mentioned some of the problems, that we have there. Clearly, lack of drugs is something that really affects the Pan-African countries, or rather Pan-African solutions when it comes to access. But maybe you can take us through, some of the solutions that are available to ensure that we have a harmonized way of having drugs, readily available drugs for Africa.
Yeah, certainly. I think every pharmacist knows where to go get drugs. This is not really the barrier. What has been a barrier access to affordable, appropriate financing. It's very difficult to get the capital. If you're a pharmacy, if you are a hospital, that working capital is a big investment. And the typical financial solutions available have been a real rate limiter on what is available. And so we've been really excited by the progress that our own financial products and services have meant for pharmacies, really tailored and very, very affordable for them. But also, fintech companies across the continent are doing really tremendous things to revolutionize, modernize the way that that money flows. And it's a big part of what the free trade area is setting the foundation for, sort of a new generation of how we transact and trade that reduces the cost of capital and reduces the cost of operating in these markets. And so a big part of what we're doing in building our solutions is also making sure that we connect to and plug in with this with our peers, the other health tech companies and fintech companies who are building out their pieces of this future. And so making sure that we all can connect and interoperate is a really big part of the way forward.
Great. And then how best then, Michael, from where you sit, how best can we, sensitize on more appropriate formulations and packaging for the African patient, to cap the importation cost and also ensure a developed continent? From your end, what you are doing, and also generally how we can go about all of this, Michael?
Yeah, well, in terms of what we're doing, we are trying to make it much cheaper and much more effective for any manufacturer to go to market. The ability for a manufacturer to list their products with us and our supply chain, and then for us to manage everything from all of the planning and forecasting to the fulfillment, delivery, and all the financing for our network of now close to 1,000 pharmacies. We are making it much cheaper and easier and more profitable for manufacturers to succeed, which kind of levels the playing field, meaning that domestic manufacturers and those smaller ones that are investing in more appropriate packaging, more appropriate formulations, have a much faster route to market, removing those barriers to entry. But more broadly, I think we can learn a lot in the private health sector from the approach that the public health sector has done. If you're familiar with the Global Alliance for Immunizations and Vaccines, Gavi, a big part of their origin story is aggregating all the demand for Africa and other emerging markets, other developing countries, and going with one voice to the manufacturers. And in that, they were able to shape the market around the needs of this really fast-growing but otherwise overlooked part of the world. And I think that we have the opportunity to do something similar. But it starts with aggregating and making sure that we are all going out together. So for instance, when a pharmacy or hospital joins our program, Shelf Life it's called, when they join Shelf Life, they are joining the largest distribution networks on the continent. And they become part of this much bigger, much stronger purchasing apparatus. And in that way, we are able to access not only cheaper product, able to influence the products that are invested in and are brought to market next. So I think there's a lot we can do in simply reorganizing how we work as an industry.
Okay, great. And maybe probably what are some of the, regulation policies or framework that maybe a good example is India, which has the highest number, of drugs or drug manufacturers. What can we borrow from India? What can the Kenyan market borrow from India, East Africa, and also Africa as a whole? But let's start from home.
Well, I think India has one natural advantage is that it's one country. States are obviously very strong in India, but it's one market. I think this is part of the vision behind the Africa Free Trade Area. Is if we were to begin to remove the barriers to trade within the continent, you can begin to consider Africa one market. And that completely transforms the investment case. You're now no longer talking about, well, what is the investment case for going into Kenya or Uganda or Tanzania by itself? You're able to look at the whole continent. I think we are still very far from that, but that is the vision that the policymakers and those helping build this free trade area have in mind, I think. And I think this first step, this 1 year anniversary that we've celebrated, is really just the beginning. I think once we've opened this free trade area, it allows us to do things next specific for each sector. For the health sector, I believe it will begin to look like normalizing the regulations so that a manufacturer in Nairobi can access the market in Lagos as easily as they can the market in Mombasa, say. So I think this kind of opportunity, again, will allow manufacturers to take on, to be able to raise more capital, to justify investing in that opportunity, and really begin to change the dynamics of access to healthcare.
Okay, great. And on those dynamics, let's move to matters franchising, Michael. And seeing that 94% of Africa's pharmaceuticals are imported, and there are only 375 pharmaceutical manufacturers currently on the continent, compared to 10,000 plus in India. Now, maybe you can take us through some of the franchising ways or something that we can adopt when it comes to that, because I understand that is something that you are campaigning or championing for from your end, Michael.
Right. Well, I think there's lots of ways to do this. I don't think it means that that every country needs to necessarily have a global innovator manufacturing company domiciled there. I think that there are a number of ways that the really great manufacturers that are already in Africa can be expanding, can continue to build on the capacity and the great brand and the great workforces that they already have. The second part, I believe, is also partnerships. Like we've begun to see this in South Africa, where some of the products that have been pioneered abroad, outside in Europe or the US, say, can be manufactured in Africa. There can be a technology transfer to African manufacturers, and this can not only be an economic advantage, but do a lot for supply security and ensuring availability everywhere else. I think short of that tech transfer, there's really so much that we can do to invest in new manufacturers and new opportunity around this African market as a whole. And I think that presents the business case. This African Free Trade Area begins to build the business case that will unlock that and enable it. But it does take more than just policymakers making a free trade area. It takes entrepreneurs and investors able to see that opportunity and envision what a Pan-African health market and health system could look like to begin to build it. So I think that's the challenge that is left with all of us to take from this point.
Okay, great. Michael, just maybe as we wrap up this conversation, your part in short when it comes to understanding the relationship between trade and health, and also on improving access to healthcare across Africa by use of technology. Maybe something that you can tap into that or add into that as we wrap up this conversation.
Yeah, well, I think something that something to leave this conversation with is that so much is possible, and we hear so much about the technology companies and all the investment coming into these markets. And I think it's a huge amount of responsibility that we have to make sure that we're building the future we want, the right future. We're using this opportunity to correct some of the problems that have been in the industry and in these markets in the past. And so I would like to encourage our clients, also our competitors, and our all of our colleagues to make sure that we aren't just forwarding sort of making a tech version of an industry that is unfair or unequal, but we are in fact using these new tools and this new opportunity to build something truly equitable and truly sustainable. I think this is the challenge that we have going forward.
Great. All right. Before we wrap up fully, there's someone who is asking, I don't know how you'll respond to this, but they're asking, how can I work with field intelligence? There's it's a pharmacy. Yes, it's someone working in a pharmacy.
Well, we welcome them to join. If you go to shelflife.co, you can create an account right there, and we will be in touch to get with you. But I think joining as a pharmacy, joining Shelf Life is one of the best things that you can do. I think we've really tried to build a great service for pharmacies that really takes the risk out. We've put many millions of dollars into chemists and into pharmacies across Kenya, and yeah, we welcome you to the service. Please get in touch.
Great. All right, so there you have it, how we can improve access to healthcare in Africa by use of technology. That has been Michael Molan, CEO and co-founder of Field Intelligence. That's it on That's Info. Now we take a short commercial break, but stay tuned because there's a lot more coming up.